The site of care programs themselves have been around for many years. Payers have been employing site of care programs for the past, 5, 7 plus years. And historically, those have included autoimmune drugs and immune globulins and other drugs. But historically, oncology drugs have not been included. And what we did in this pilot was really to explore the feasibility of oncology drugs in a home infusion program. And we knew that doing so ourselves, just at the payer level, would have been very challenging. So what we did was we partnered with one of the leading provider partners in our market, which was RWJBarnabas Health and CINJ, the Cancer Institute of New Jersey. And we started this collaboration in 2020, so really at the heart of COVID. And what we knew was that, especially at the heart of COVID, people were not wanting to go into the hospital or the facility to get, care. And we saw in our data there was large deferrals of care. People were skipping infusions and a whole lot of other impacts from COVID. And so we started having conversations with CINJ to say, how can we work together to create a model, which doesn't really exist today around oncology home infusion, work together to understand who the appropriate patients may be, what the drugs may be, what are the inclusion criteria, exclusion criteria, and how do we work together and create a program where select patients can be moved to the home setting for their infusions. And the benefit of that being that, especially during COVID, right, we can get people out of the hospital into the home, decrease risk of COVID exposure, but also just kind of create new care delivery models, for oncology care. So we started this, like I said, in 2020, and we actually just concluded the pilot this year, early in 2023. When I say concluded, I mean we really moved it to become the standard of care. So it's no longer a pilot; it's just what we're doing on a day-to-day basis. So we started small, and really before we started, we kind of created these workstream groups to understand inclusion criteria, exclusion criteria, the drugs that we want to include. We were working with Qualitas for Home Infusion, which is part of RWJBarnabas Health. So we kind of brought all of these parties together, wanted to make sure we understood the operational aspects and from a benefit design perspective. And so we started with a handful of drugs in the oncology space. I think currently we're a little over 30 drugs that included, plus a handful of additional biosimilars for some of those products. And when we go year by year in 2020, we started kind of towards the end of the year, we had 18 patients enrolled, and that really ramped up year by year. So in total to date, we've over 160 patients in the program. That includes Horizon patients and non-Horizon patients. So we initially started with RWJBarnabas and CINJ, focusing on Horizon patients. They expanded the program out later on to include non-Horizon as well. So in total, 164. In this just 2023 alone, it was 61 patients. So we've been able to grow the success of the program. And one of the actually barriers that we hit, and it was a very successful program, is that we actually couldn't enroll patients fast enough. So part of what the learnings was this takes time, mostly from the facilities and some work from our end at Horizon. And so some of the kind of learning lessons was that we need some dedicated resources for this program. And those were there were 2 FTE resources that were added by CINJ in 2023. So we hope that'll help with some of the backlog of patients, and that enrollment will just continue to increase in time. One of the things in the very initial work streams, it was creating the drug list. And that was really a collective effort of what the kind of the clinicians at Horizon thought, and probably more relevant to the clinicians at CINJ thought were relevant. And so we kind of started with a handful of drugs, added additional ones to the program. Some of the big ones would be trastuzumab, rituximab, bevacizumab, handful of others. There were certainly some drug classes that we stayed away from, at least initially. Big one being the PD-1 inhibitors, obviously the big volume there. And we didn't move forward with that drug class, just really due to some clinical reasons. A lot of those patients were on combination therapy. They were going into the facility anyway for other drugs that were not in the program, or they're going into the facility for their visits to see the provider, or they were in the facility anyway. So there really wasn't huge efficiency for the patient to get their drug at home, but still have to go into the facility for other services. I mean, that's a big one, though. I mean, we know Keytruda and the like are just, top of, top drug spend for probably all payers. And it's one that we're looking at. There are some payers across the country that are doing different programs with the PD-1s. We just didn't feel like that was kind of our, ones that we wanted to include in it. That is one of our follow-ups and kind of next steps of the program as we think of expansion is, okay, well, can we replicate this program with other providers in our market? As well as, do we think that we'll have better comfort with the PD-1 inhibitors? And it would be certainly in select patients. It's not going to be in all. But I think that's kind of on our radar for, if we could expand this out, we would certainly like to include those drugs.